What's going on, guys? Dr. Choffner coming back at you. Happy Wednesday to everyone. If you're new to our YouTube channel, like and subscribe. We have new videos coming out every week, every Wednesday to be exact. If you guys are new as well, join our Facebook group called Mobility Simplified for Weightlifters, where we give you tips and tricks. We covered the ankle joint in January of last month. This month we're focusing on the knee and the meniscus in specific, and that brings us to tonight's topic overall. Tonight's topic is going to be what to do if your meniscus of your knee is injured. Okay, a lot of people get stuck with this one. They go see the doctor, they go see a chiropractor, they see a physical therapist. They're kind of spinning their wheels without getting anywhere. So we're going to talk about what kind of entailed when you get kind of damage done to your meniscus or you get injured. Okay, so 3 things in detail we're going to talk about here. First is that you want to seek medical attention when you want to go through those tests. They're called special tests that we covered last week. So if you haven't seen last week's video, go back, watch last week's video, do those tests, see if they're positive for you or if they're negative. That is super, super important. Do that before you even go any further in this video. Number 2 is request imaging. You go to see your doctor. Research shows that special tests, or the test the doctor does, or the test that I showed you last week that you can do on yourself or have a friend do on you, the combination of doing those as well as the kind of getting imaging done, whether it's an X-ray or an MRI, are going to give you the most accurate results telling you if your meniscus is truly injured or if it's not at fault. All right, that's number 2. Number 3 is attend physical therapy. They're going to give you a script at the orthopedic physician's office to go to physical therapy for about 4 to 6 weeks. And then they're going to test and retest if you have a good therapist. And if you're not getting any better, or the pain is worsening and swelling's kind of going up, that pain's worsening and strength is going down, that's a red flag. That might mean something more serious is going on. So you want to go back to your orthopedic physician, talk about the next steps. Okay, so just to recap, those are the 3 steps. Seek medical attention, number 1. Request imaging, number 2, and number 3 is attend physical therapy. Why should we do all 3 of those things? Those special tests we talked about when you seek medical attention that you can have a friend do on you and have your doctor do on you or your physical therapist are super important because they're going to determine if your meniscus is truly injured and how severe it might be. Right? Some of those tests might show that you have like a partial kind of tear in the meniscus. Some can show you have a complete tear. And there's other symptoms that are important too, like catching, locking of your knee, like it feels like it gets stuck and you have to shake it out, pain with up and down stairs, right? Pain with deep squatting. So that brings me to my next point is you want to avoid deep squatting and locking out of the knee. And you want to avoid those because they're both going to stress the meniscus if it's damaged and bothersome, right? This means avoiding bending that knee fully, so not squatting below 90 degrees because it's going to put a lot of force on the knee when you're bringing that kind of tibia bone close to the femur bone or your calf close to your hamstring, like a seated leg curl. You want to be careful not going to end range on those. And the other thing is knee straining, right? You want to be careful if you're doing a leg press or knee extensions not to fully lock that knee out, because if that knee's fully locked out, it's going to cause pain and damage and discomfort. It's going to make your meniscus pain worse, and it's going to scale you back in your rehab journey. Okay. The other thing is seeking medical attention from an orthopedic doctor, right? They will do those tests we went over last week, like I mentioned. They'll probably start you with an X-ray because they're cheaper to carry out, less radiation than an MRI as well. And then what they'll do is they'll give you an anti-inflammatory typically, or they'll give you a cortisone injection, which will help reduce swelling if they see that on the X-ray. Then they'll schedule you for PT for 4 to 6 weeks, right? They'll see how that goes. If it does not go well, then insurance should approve you for an MRI as long as your therapist did a good job with their notes and your doctor same. If it's still bad and they go through and they do that MRI and they see it's a complete tear through the avascular layer that gets no blood supply and the vascular layer, then most likely you need surgery if it's restricting what you can do, meaning like you're a runner, you can't run, right? Maybe you do like CrossFit and you can't do box jumps anymore. It's a huge part of your workouts. Maybe you're a cyclist and you can't cycle anymore. Obviously, like those are things you enjoy and you want to be able to do in your life, so you need to have the surgery for that. And a lot of times, depending on how bad it is, the surgery is just a cleanup. They call it meniscectomy. They'll go in, they'll clean up the tissue around that area, they'll shave down the bone a little bit, and they'll kind of snip it, right? When the meniscus gets torn, it's like a long tongue hanging over teeth, right? It's like that. So not to disturb you or anything, but they'll cut that kind of edge of the tongue hanging over the teeth back a little bit and then shave it down, kind of like the edge of like an old blanket or a towel. They'll clean it up. Recovery is usually 4 to 6 weeks. It's fairly quick. Sometimes it's about 2 to 3 months, depending on how severe it is. Sometimes they need to actually go in and repair the meniscus if you're younger and it's in good shape or good quality. Sometimes they need to kind of do more more in-depth procedures, and it takes a longer time to recover. It depends on where the actual tear is, how kind of deep it is and how serious it is and what your symptoms are like and how you present. Okay, there's no black and white in physical therapy, guys. Unfortunately, it'd be really easy if there was. Okay, so now finishing up with the how, right? Resting may be necessary if you're kind of doing a lot of repetitive activities, like I just mentioned, cycling, running, jump roping, right? Any of those things that involve like a lot of high impact, you probably want to cut back on a little bit, just because you want that inflammation to subside a bit, and the doctor will probably tell you the same thing, right? You want to scale back also your duration if it's still painful. So how long you're doing something, scale back from 60-minute workouts to 45-minute, right? Maybe even from 45 to 30. You want to change your frequency, so how often you're doing something. Maybe you're doing it 3 times a week, you want to scale back to once or twice a week. And then your intensity, right? So if you're using like 50-pound dumbbells for box jumps, go down to 25-pound dumbbells, right? If 25 still hurts, go down to doing them without any weight. You can still exercise and do things without irritating it, as long as you know what to do properly and how to scale back certain variables like those things. All right, and then make sure, guys, when you're getting medical advice, if just one thing I can wrap up with here, make sure you truly trust your doctor, your physical therapist. Even if it's torn, right, you probably can sometimes get by without having surgery. There are people who tear their meniscus or tear their ACL who don't need surgery, who can get by as long as they strengthen the proper muscles and they kind of learn how to properly rehab. It's not always the case, but sometimes, I'd say like a good 50 to 60% of the time, people can get away with this, and there's studies to back that up. So don't rush under the knife and get multiple opinions. I don't care if it's like 2 or 3 physical therapists or it's 2 or 3 doctors. When you go to get your car, even if you're at a used car dealership, you're not gonna go to 1 and buy it, right? You're gonna go to 2 or 3 just to shop around. Same thing when you look at houses. You don't usually buy the first house, although we do live in a crazy time right now with crazy rates. So it might be a little bit different right now, but in terms of your body, treat it as like, gold, right? Go get multiple opinions, read reviews, talk to other people. If they refer you and you trust them, stick with that doctor, all right? So that is everything for tonight, guys. So just to recap on those 3 steps, you want to first seek medical attention. Number 2 is request imaging. And number 3 is attend physical therapy. All right, so hopefully you guys found this valuable. This is our 2nd video in our meniscus series for this month of February. Thank you guys so much for watching. Continue to watch. We have 2 more coming in the next couple of weeks on Wednesdays. Like and subscribe. Join our Facebook group called Mobility Simplified for Weightlifters. And follow us on Instagram at Dr. Choffner PTSC, where we're coming out with just new exercises every Monday, Wednesday, and Friday. And then Saturdays, we do a little bit of an educational clip as well. All right, thanks guys so much for watching, and have a great rest of your day and have an awesome weekend.